As a cardiologist, I'm going to say something that might surprise you. Not every patient should stay with their doctor. That doesn't have to mean that your doctor is bad, and it doesn't mean that you're difficult. But healthcare works best as a partnership, and sometimes the fit simply isn't right. So today I want to talk about how to recognize that and what to do about it. Medicine isn't just tests, medications, procedures, and appointments. Medicine is about health, and sometimes it's not just you that needs the health check, but your relationship with your doctor might need a health check too. Let me explain. It's a relationship. Sometimes it's a really long relationship. I've had very special relationships with my patients spanning a couple of decades or more, and they really stay with me long after a patient has sadly passed away. And it's truly important that these doctor-patient relationships work for you and your doctor. Otherwise, they help no one. When you feel heard, you understand your condition better, you are more likely to follow a plan, you ask questions earlier, problems get picked up sooner. Let me be clear about one thing. You don't need a doctor who agrees with you about everything, but you do need a doctor who listens, explains their thinking, and works in partnership with you. Unfortunately, sometimes I hear from patients that they just don't feel heard by their doctor. And I'm not perfect. Maybe that's been the case even with me, and perhaps I will never even know about that, because you aren't likely to say that to someone's face, are you? But I know, and I'm willing to admit, that if I'm not a good fit for you as your doctor, you and I are both better off if you find someone that works better for you. I won't be offended, because this is in your best interests to feel comfortable with your choices. If you don't, then that won't end well for either of us. So I will never stop or be offended by one of my patients looking for a second opinion. And if they prefer the other doctor, that's okay. I just wasn't the best fit. Sometimes patients struggle to describe this. They just know something doesn't feel right. It might be that you leave appointments confused. Your concerns may feel brushed aside without explanation. You feel rushed every time, or you feel your symptoms are minimized rather than explored. You stop asking questions because you don't want to be a nuisance or feel stupid for asking. You should never feel stupid asking questions. There are no stupid questions, only stupid or thoughtless answers. Now, not every short appointment means you're being dismissed. Sometimes things are straightforward. But there is a difference between efficiency and feeling unheard. In a good doctor-patient relationship, you feel safe asking questions. Your doctor explains the reasoning, even if the answer is no. Decisions are shared. You're allowed to disagree, and importantly, you understand the plan. I often say that you should feel that the two of you are at least aligned regarding the direction and character of your care, that you don't feel forced into anything that doesn't feel right to you, and that the goals are shared. You may not always like the advice given, but you should understand it, and you should feel respected. It's important to acknowledge something. Modern healthcare is under pressure. Appointments are short. Doctors are managing complexity. Communication styles differ. A doctor can be clinically excellent and still not be the right communicator for you. And that's nobody's fault. Changing doctors is not a failure. It's finding the right partnership. And deciding to change is rarely about one appointment or one less than ideal experience. Let's face it, getting an appointment with a specialist can be hard, take a while, and the process might even seem intimidating. But deciding to change is more often about seeing a pattern. You might consider a change if trust has eroded, if you repeatedly feel dismissed, if you leave more confused than when you arrived, if you avoid appointments because you don't feel comfortable, or if you're not following advice because you don't understand or even believe the plan. Your health is too important to stay in a relationship that isn't working for you. Before changing doctors, it can help to try one honest conversation. That might sound like, I'm still worried about this, or I don't feel I fully understand the plan, or can you explain why we're not investigating further? The majority of doctors are decent, caring people who welcome clarity. Sometimes that single conversation transforms the relationship. But if it doesn't, that tells you something important. You don't need a dramatic exit. You don't need to justify yourself extensively. You can seek a second opinion. You can transfer your records. You can simply book elsewhere. Good doctors want you to receive good care, even if that isn't with them. This isn't a rejection, it's alignment. You deserve to feel heard in your healthcare, and that doesn't mean endless time chatting about random things. In reality, where time poor and balancing giving you the time that you need with the opportunity to do that for everyone else we also need to see that day is challenging. It doesn't mean that you can tell us in every detail of every condition or the 60-minute version of your life history, much as there are truly times that I have enjoyed and savoured the stories my patients have shared with me about their lives. It also doesn't mean agreement on everything. It also doesn't mean that sometimes we might have to say things that seem more direct or even harsh if the messages are not being received. Not everything I say will be something you agree with, want to hear, or indeed might not find tough. But that doesn't mean that the conversation isn't with your best interests in mind and at heart, or gives you a better perspective on which to base your important decisions. These can be really hard conversations. It's a difficult balance to have them compassionately and with enough directness that the messages are understood. But hard conversation or not, it does not mean that your concerns are not taken seriously and explained well. The right doctor doesn't just treat your condition, they work with you. And when that partnership is right, everything becomes easier.